Greetings and welcome to your destination. You reached the Psychological Wellness Hub. We aim to help you build your knowledge and wellness around better understanding mental health and psychological concepts. Welcome back to the channel. Today's topic is geared towards answering this question. What are the levels of mental health and substance misuse treatment? What do you mean by levels of mental health and substance misuse treatment? We're talking about specialty treatment levels or types involving the treatment of behavioral health conditions. Treatments that focus primarily on mental health, substance use disorders, and other medical conditions, and many more. Here's a basic understanding of the levels of mental health treatment. As stated above, mental health levels involve different forms or types of treatment that have different approaches or intensities. They involve professional relationship between a behavioral health or mental health provider with a patient, client, or consumer. The relationship is agreed upon one where the mental health provider and the patient work together using the treatment in different treatment settings or types of locations as a mechanism or portal to reach the patient's, client, or consumer's goals. In some cases, the patient, client, or consumer may be ordered to undergo treatment. That is, mental health or substance misuse or addiction treatment in one of these settings. In this case, this may involve a setting where there are restrictions in access and independence, outside settings where there are consequences associated with not only following the treatment, but also with a general regard or ability to move about freely and independently. Generally, these consequences involve legal or forensic system enforcing them. What do we mean when we say treatment settings or locations for mental health or substance misuse treatment? There are many different ways to understand this. Each level or setting is backed by research and shows its effectiveness, like psychotherapy and psychiatry treatments. So let's get to what we mean by settings or locations. We will talk about each one briefly here. These will not be exhaustive, and many details will be covered further in future videos about each. Mental health and substance misuse or addiction treatment that can be done in a variety of settings. We'll start from the most demanding or intense to the least demanding or intense level. Some might use the term restrictive also to describe some of these settings. All these settings range from very clean and supportive environments to environments that are more unsettling and less sanitary. The first to consider is the most intensive or restrictive. This is usually things like state forensic hospitals or sanitariums through the legal system. So what do we mean by sanitariums or state forensic treatment settings? These are settings that always involve inmates who have been involved in the legal system as part of the condition of their incarceration, including some or all of their time in a setting like this. The next level is the state hospital. State hospitals, which involve mostly individuals whom do not give consent and are there involuntarily. Again, we're talking about mental or addiction-based facilities, similar to what we call asylums, but do not generally involve the legal system unless temporarily needed. Has resources that sanitariums do not possess, or need a step-down or transition part of the legal commitment. The next level involves forensic residential treatment programs. Often, when we refer to this, we are talking about legal treatment programs for individuals who are being sent for things like sex offenses or mandatory sex offender treatment, or juveniles who have been violated sanctions of their probation or incarceration and now are compelled or forced to enter a targeted treatment in a forensic or legal, residential setting. The next level of care is called the inpatient mental health or psychiatric stabilization units. Often individuals have temporary stays on these units to offer rapid or emergency inpatient care. These units are generally locked, restricting an individual's independence to promote healing and safety. The patient generally is in a more impaired state psychiatrically and vulnerable to their own actions or the actions of others. To help this patient, client, or consumer to reach a level of mental health stabilization to either return home or to continue on to other levels of treatment. These units generally have acute and subacute levels. The next level of care might include detoxification units. These involve units that are on a range or a continuum. They exist in the community or private hospitals. They exist in VA hospitals or the Department of Veterans Affairs hospitals. Often individuals have temporary stays in these units to offer rapid or emergency inpatient care to medically detox from substances and alcohol. The next step down level is called residential treatment units or facilities. They often get confused with inpatient lock units, but are not the same thing. Residential is like it sounds. You are in a residential setting in a treatment facility. Treatment is more psychologically or therapeutically oriented on these units. Residential units are on a range or continuum as well. Some are very large, while others are much smaller, have less people, and are more intimate in terms of offering greater ability to connect with your fellow residents and treatment staff. Individuals who go to residential units are there for focused treatment for things like PTSD, addictions, and programs for severe and persistent mental illness, homelessness, and vocational rehabilitation. They also offer these to the Department of Veteran Affairs, or the VA. The next step down or level is called the partial hospitalization programs or partial hospitalization units. These are what they sound like. They're partial hospitalizations, basically an evolution of the day treatment model. You come to the hospital a couple of days a week and check yourself in for a number of hours each of those days, and then you go home at the end of the day. These are voluntary in most cases unless under a court order. You choose to come in and have treatment in a partial hospital setting so you can gain access to things that at a lower level or less intense setting may not completely offer. The next setting or step down level is emergency department or emergency services at the mental health centers. These are generally located in the hospitals or community mental health or substance abuse treatment centers. These are usually at the same locations where the inpatient facilities are or are generally located. Generally, you go here to receive rapid and brief interventions and then are generally sent home or sent to another level of care. Another level of care might be something like an inpatient, partial hospitalization, community mental health, or outpatient or residential settings. The next step down level are mental health urgent care units. These are just like the other urgent care units you have to go to for medical concerns. Imagine a blend of the medical unit and the emergency department, except that this is urgent care and not as intense as an emergency department. In these settings, you're not in an emergency, but need urgent access to mental health or substance misuse care. Generally, you go here to receive a rapid and brief interventions, and then generally sent home or sent to another level of care like inpatient, partial hospitalizations, community mental health, or outpatient or residential settings. Generally, the difference here is that the care is less emergent compared to the emergency department or the emergency services at the mental health community centers. The next level or step down is called intensive outpatient treatment. These also fall on a continuum. They involve going to treatment several days a week to an outpatient treatment facility in the community or at the community mental health center, the VA, or a private hospital. They are not an inpatient hospital setting, though they may be offered at a local hospital. The next level down is called the outpatient mental health or behavioral health clinics that are on an outpatient basis. These are like they sound. They are outpatient, like an outpatient doctor, appointment that you have, an outpatient clinic with a dentist, those places that you would go for a general clinic appointment. These are the lowest level of care in terms of restrictive environments, but can have the least to more intensive levels of treatment. Usually they serve a majority of the community outside the inpatient hospital setting. Why does one want or need different levels of treatment? One has decided to be proactive, that they want to improve their lives or the situation before it becomes a problem. If it already has become a problem, then one is going to seek treatment to resolve the problem. Having different treatment options or levels allows you and your provider to get you matched to the level of care that is necessary for what you need at that given time. A mental health crisis or substance misuse crisis might require one of these levels of care. You might need detoxification services to avoid things like delirium tremens, which we'll talk about in another video, which is basically a consequence that comes from withdrawing from alcohol and other substances. The need to do something more intense than outpatient, but doesn't need that full inpatient level or state level services. Some will go there when they need adjusting to new life situations, things like having a divorce, a breakup, or relocation, have moved to a new area and are struggling, job stress, marital resilience, or adjustments with a new role. How do we learn more about each of these treatment settings? We will talk about these more in other videos. Feel free to come check out the channel to watch more videos and topics on how to make the best use of them should you choose to do so. We hope you found today's topic was useful for yourself or someone else. Let us know if it was by commenting below. Let us know what you'd like to hear about or what topics could be useful to you by commenting below, and we'll take it under consideration. If you like what you heard today and would like to hear more from Destination Psychological Wellness Hub, please consider liking and subscribing to the channel or page. This will help you get the newest content produced by the channel to you. Please tell all your friends and family about this channel or share this and other videos with them on the channel. Encourage them too to like and subscribe. And as always, we hope your psychological wellness continues to grow with us in this community. Thank you.